Welcome to the Dermalorian Podcast from the Dermatology Education Foundation. In this edition, we'll get some insights on the role of the dermatopathologist, and we'll look ahead to Psoriasis Awareness Month and consider the patient impacts of the disease. We'll also resume our conversation with Michelle Sullentrup, founder and CEO of MyDermRecruiter. Last month, Michelle shared exciting data about rising compensation for NPs and PAs in dermatology. This month, she shares some tips for quantifying your value to a potential employer.
If you have experience in dermatology, I've talked about this before, that I always attach something called a production explanation, almost as an addendum to a resume. So if you are having those phone calls and they're like, yeah, send me over your information, or send me over, your resume or CV with, some information so I can forward that on to the doctor. One thing that I typically tell people to include in that resume is some type of blurb in your introduction about your past production to practices you've worked in. And what I mean by that is almost a little blurb that's a production explanation, right? So it just says, in my current practice for the last 2 years, I have collected on average 650,000 annually. So that they have an idea of what you're capable of producing for their practice. Now, when you get into a conversation about an interview and you're having an interview and it's going well, and you start talking about, negotiation basically, and you're getting into a point where you are going to talk about specifics of your contributions, your accomplishments. That's when I tell people to have ready to share a production explanation. I tend to say that you really aren't going to hand this out, right? Like you do a resume. But it's something that if it's serious, a serious conversation, you're getting into a possible offer or negotiation, I really like people to have a production explanation prepared as an addendum to that resume, okay? So on the first reach out, first communications, we are referencing it, right? And a little blurb in that intro email or that intro conversation. But when we're getting down to brass tacks, that's when we really want to have this as something that's in writing as an addendum to the resume that you can provide to that potential employer. That addendum to the resume is going to include your total years of experience. It's very, very simple. So people are like, oh, well, wait, how do I put this together? Literally what I'm saying, it's an addendum to resume for Michelle Sullentrup, dermatology PA. And I have on there production explanation, total years of experience, 5 years in dermatology practices, right? And then I put production for the following years and average patients per day. So I like to use the last 5 years. So you'll see me put a little bullet point that says 2020, in the year 2020, I brought in $421,000 in collections. I averaged 15 patients a day. It was my first year in practice, right? So 2021, I went up to 551,000. I was seeing 18 patients a day. And so on. And up to 2023 or 2024 now, where I'm on pace to do 650,000 or 700,000 annually, and I'm seeing 30 to 35 patients a day. So I think it's important to show 4 years, maybe 5. In this instance, I'm giving you, I was saying, oh, I have 4 years of experience, and I listed out those 4 years of having what I produced for the practice I work for and what my average patients per day was. In addition to that, I like to have a couple patient reviews. You can reference Google reviews. You can reference any of the medical, review companies that practices use, where they record their, all of their reviews for people. But I like to have links associated with that if it's going over via email. And if it's not going over email, then I like to say, 2023 current practice, my current practice ask patients to fill out a paper card for reviews, because we still have that going on where they're not doing electronic, they're doing a paper card at the time of the appointment. And with a rating of 1 to 5, with 5 being the best, my average rating for 2023 was 4.9. You have to brag on yourself. You have to have something to set yourself apart when you're looking at a very small regional area that you're targeting to get your best opportunity in. So that is something that I think is important, especially for NPs and PAs in a small market. I think if you anytime you're in a negotiation, if you have this addendum, this production explanation form as an addendum to your resume, it really sets you apart regardless. So whether you're looking in that little regional area or you're looking, in 3 states away, it's a huge, huge data point.
We'll get back to the conversation with Michelle Sullentrup in just a moment. But first, it's time for the Dermalorian Derm Decoder. What do you really know about your dermatopathologist? Dermatopathologist Michelle Hure of OC Skin Lab in California talks about the role of the dermatopathologist, who is dual certified in dermatology and pathology.
We are your partner in this two-way relationship with your patient. That's, I guess, a three-way relationship. So we're going to be giving the accurate and specific diagnosis with a fast turnaround time, or at least as fast as we can. But we also need the clinician to give us all of the relevant information to make the best clinical pathologic correlation. And that's going to be not just what you fill out on the requisition, but also the best specimen. And only together, these two things together, can we have that high level of dermatologic care. So you have to realize sometimes our goals are not always the same. Yes, we all want to have that diagnosis and help the patient. But the goal that you have in the exam room may not be the exact same goal that I have as a pathologist, right? So you want to get that definitive diagnosis, which will guide your treatment options, and you want to get the best prognostic factors for your patient. You want to know exactly the course of the disease for your patient. And then sometimes you just want to get rid of something, a therapeutic removal. You want to send to biopsy to have it read as by the pathologist, but you also want to just cosmetically remove something, right? So you have certain goals. The goals of pathologists, yes, we do want to establish a diagnosis. Sometimes you're not able to give a definitive diagnosis, but sometimes you can. Specifically, it's important for malignancy and what the stage of the malignancy is. That's going to help tremendously. But sometimes for inflammatory lesions, definitive diagnosis is not necessarily possible. So our goals are going to be to give, well, what is the most likely diagnosis? And that is really coming down to identifying the changes that we see in the epidermis, the dermis, the fat, what type of cells, the distribution of the inflammation. These are all clues that are going to give us more of an idea of the diagnosis, but it may not be definitive.
Doing what's best for the patient is crucial. When you're on the job market, you also have to do what's best for yourself. Start by knowing your numbers.
People are interested, like we talked about before, people are interested in data. They want to know what you're really capable of. They want to know what you can bring to the practice, as well as being a fantastic provider. Let's face it, right? This is the business of dermatology. So they want to know too what you're going to be bringing in the door to that practice. So I think in order to create this addendum to your resume, you really have to know your numbers. So if you're in a practice right now where you don't know your numbers, you don't know last year's production for yourself, or you don't know what your average patient per day number is, boy, you got to get that stuff before you even consider looking for a new opportunity. You want to know those things because all those factors affect your compensation, whether you realize it or not. Patient volumes, collections, non-revenue value of a candidate. So, you've got a great social media following, or you've got outstanding reviews. All your patients give you reviews because you're so nice. Don't overlook the fact that anybody looking to hire you is looking at your costs as an employee, your benefits, your expenses, your overhead, minus, all of that goes into that factor of what you're bringing to the practice. And that directly affects your compensation, whether you realize it or not. So I think the key to knowing all of those numbers, how much you're producing in a practice, what you're bringing in to the practice, because we have to remember that dermatology practices are most often for-profit business enterprises, right? And understanding the value you provide a dermatology practice is extremely important. And if you know all of your numbers, like we talked about with that production explanation, you know what you're worth, you can really learn to negotiate for yourself a fair compensation. And that applies also if you're in a practice that you absolutely love, but you're seeing in your marketplace, there's all these other jobs available that are paying a lot more. You see that the base salary might be $25,000, $50,000 more. You see that, or you hear, right? Maybe you're networking and your friend just got a job over here making this, and man, I'm not making that. I really love my practice. I love where I'm working at, but I'm not making that. Knowing those numbers, knowing what you brought in, last year, what you brought in last quarter, and what that equated to in collections for the practice, and how you assisted in the non-revenue factors, like you pushed out so many great reviews. Because as a patient, right, like if I come on to the website and I'm like, oh, are these guys any good? I like this practice, they're close to my home, let me look at the reviews, because that's what we're all trained to do in this day and age. If they see 15 reviews for you that are all 5-star, that's a that's a non-revenue factor, which in fact brings them revenue, right? Some management you're doing, or product sales, or reviews, social media, all of those things are part of knowing your worth and knowing your numbers. So the key to that is getting negotiation of where you're at already. So you love where you're at and you're like, I want to negotiate a better deal. You have to get specific about your contributions and your accomplishments to that practice. You can use that production explanation we talked about to display your numbers and your value to your current manager or a potential employee, but in this case, you're a current manager, and say, hey, listen, I'm seeing out in the marketplace, this is what's happening. You have to have that 10 seconds of courage, as I call it, to say, this is the data that I'm seeing. This is what's out there. I would like to be compensated in this manner as well, based on what I'm doing for the practice. And when you have it in writing to them, that production explanation, you have all of those non-dollar contributions that you're doing, boy, it's hard for a practice manager to say, yeah, no, we're just going to stick with what we have, because I guarantee you those practice owners that are above them are saying, we don't want turnover. We want to keep our great people happy. So they know they have to step up in the market. And I've even had, this is interesting, I've even had candidates who were talking and negotiating with their current employers, and they would call us and say, they're telling us they're not going to negotiate. So I guess I'm going to be looking for new opportunities. So they call MyDermRecruiter about jobs in the marketplace. And, they may talk to us and say, I wish they would listen, and there's been many times where we'll offer to them, like, well, if you want us to have a conversation with them about the competitive, opportunities in the area, we're happy to do that. It's not something we do on a regular basis, but we have had that happen before, because sometimes, they may not believe you what's in the market because they're so busy running their practice. They haven't stopped to look up and see what's happening in their marketplace. And you're showing them, you're bringing it to them. Listen, this is what these other groups in the area are offering. It can be an eye opener for them, and they may go, yeah, we gotta step up to keep our best people on board. So you really do have a lot more power in negotiating a better deal for yourself at the practice that you already love and want to stay at than you realize.
You can get more insights from Michelle and her team at mydermrecruiter.com. Next month is Psoriasis Awareness Month. In this month's Dermalorian clinical clip, DEF Advisory Council member Jayme Heim talks about the need for greater awareness of this common skin disease.
I have been treating patients with psoriasis for almost 20 years now. I'm extremely passionate about treating patients with psoriasis, not only from a quality of life standpoint, but through the comorbidities that these patients have. This is a chronic disease. We need to be there to support them. I cannot tell you how many times that I see patients come in, even on a weekly basis or bi-weekly basis, that have been to 3 or 4 other dermatology practices, and nobody has treated them properly for their psoriasis. Patients know there are other treatments out there for their psoriasis. They do not want to walk around with psoriasis and feel the way they do with their skin or their joints. It affects their quality of life every day. It affects their relationships. And we need to have these tools and to educate our patients and to also use all the fantastic medications we can use safely to treat these patients.
We'll have more psoriasis awareness information pulsing out next month at dermnppa.org and on our social media channels. Be sure to follow us. Thanks for joining us for this edition of the Dermalorian Podcast.